So that's why I put this picture here. Just the image, the idea of a mastectomy, the fear of a mastectomy can cause such a self-devaluation conflict, and the program is switched on. And during the conflict active phase, we have the tissue loss during the active phase causing bone cancer. Bone cancer, my friends, is by definition tissue loss. In other words, holes and gaps in the bone. And Dr. Hammer often shares this with us, that when he was a medical student, he had a hard time with this, because he said, we always learned that a cancer is a growth. But in the case of bone cancer, all of a sudden it's not a growth, but it is a hole. It is a tissue loss. It is gaps and holes in the bones. So you know, this would translate into the following scenario, and just follow the logic. This would translate into following: that a breast gland cells breaks away from the milk ducts, migrates all the way to the bone, and causes in the bone a hole. This is the logic. But what we also understand here, and we see that why this metastasis theory has so many contradictions and there's so many unanswered questions. But what we also understand is the following: that again, routinely, the woman is sent, in this case, the breast cancer patient, is sent for lung x-ray and for bone tests, right? And the bone cancer is typically found in the sternum or in the ribs, in the area where there is potentially, you know, where there is the tumor, because this is where the self-devaluation conflict runs its course, and this is why they find the bone cancer in this area of the brain, of the bone. With German new medicine, all these conflict shocks, these diagnosis shocks, these secondary cancers of these types can be prevented, because a woman understands why she has a breast cancer, she understands why it's in the ducts, she understands why it's in the glands, she understands why it's the right or left breast, she knows when it's active, she knows what it's healing. My friends, what are we going to do? Well, first of all, we have to stop walking. We have to stop walking. And we have to educate ourselves. And we have to liberate ourselves from this kind of control. And with German new medicine, we are in control. We can live without a fear of cancer. Or to say it metaphorically, with German new medicine and Dr. Hammer's great gift to us, we can reclaim the daffodils and the color pink. Thank you.